name is Adam. I will be your Pilates instructor today. Just going to check when you filled out your Part Q forms earlier. Has there been any changes since you filled out? Perfect. No changes. Excellent, excellent. With Pilates, for some of the techniques, does everyone give their consent okay? I'll ask just before at the time if anybody needs hands-on correction any stage, but I will say, are you okay if I perform a little bit of hands-on correction before doing any of that? Perfect. Okay, thank you very much. Today's Pilates course is going to be a full body workout, working on mobilizing the body, balance, strengthening the body, stretching and lengthening out any muscles that we have. To begin with, we need to align everything for the perfect posture. Starting with our feet, lacing our feet together. Turn like a clock face, the toes out 10 to 2. Going slightly up on the toes to realign the heels in the line. So I'll bring us into a hip width position. Knees are slightly soft, not locked back, but definitely not over softened either. Slightly soft in the knees. Pelvis, I will demonstrate from the side. We're going to perform a couple of pelvic tilts. To do this, imagine your pelvis is like a bucket of water, and we are going to pour the water out the back, pour water out the front. As that pelvic movement, you can see even without my hand, you'll feel your back mobilize as you do that. Hands on hips, just so you can gauge. Start out the back, so pour water, perfect, out the back. Inhale through the nose. As you exhale, do the opposite, tip the water out the front. One more time, out the back, all the way. And in your next pelvic tilt, find the center where you're finding that balance, and there will be no water coming out the front or the back. In doing that pelvic tilt, that will have aligned our lower backs as well. Moving up into the shoulders, shoulder position. Inhale, going forward, bring it up, back and down is our ideal shoulder position. So we'll do that one more time. Inhale, going forward, move up, and then the next time you come back and down, stay in that position. Align the shoulders. Neck, lengthening up through the neck and the cervical spine. Chin parallel with our feet. Eye line and face looking forward. In Pilates, we do a certain kind of breathing called lateral breathing, which means breathing out to the sides. We will practice this now. Take a breath in through your nose and focus on the breath going out into the ribs, into your lower back. Exhale as normal. Putting our hands onto our ribs, fingers in front, thumb behind. Inhale, expanding the ribs out to the side. Exhale, normal. One more time. Inhale into the ribs, feel your lower back tighten. Lateral breathing, exhale normally, back to normal. Letting your hands rest. With Pilates, we also work on core engagement. To find that core engagement, I'm going to use an analogy of tightening a belt, and the stomach is your belt. So begin to draw your stomach in towards your spine. as much as you can. And if that is a belt, that'll be the 10th hole. Letting your stomach come back out to normal is your first hole in the belt. And in Pilates, we use the 3rd hole. So one more time, all the way in, as tight as you can, all the way out, back to normal. And in today's class, when I call out core engagement, bring it in to that 3rd hole. Do that now. It's the 3rd hole. Back out to normal as our core engagement. The core engagement that we just done, the muscle, just for everybody's knowledge, the muscle that does that is called the transverse abdominis. It is a muscle that shaped like a corset deep inside our abdominal cavity. Final form of engagement and activation is pelvic floor activation. What our pelvic floor is, it's like a net of muscles lying at the base of our pelvis, and they support the bladder and other lower organs. To activate our pelvic floor, the only way to describe it is hold it in a urinary or bowel movement. Lovely. Urinary or bowel movement. So I'm going to use a 10-story floor analogy. So do that now with me. Start to squeeze in that urinary and bowel movement as tight as you can up to that 10th floor, 10th story. Let it all the way out, back to the ground floor. One more time. Squeeze those 2 sensations up to 10. Back down to ground floor. And same as core engagement, we use the 3rd floor. So right now, contract, activate your pelvic floor up to that 3rd floor of the building. And relax. And that was, when you hear me say pelvic floor, that's what I'm asking for in today's exercises. Moving into some mobilizations of the body and joints, beginning with top of the body. Take a breath in through the nose, and when you exhale, turning the head over towards the right side. Inhale to bring your head across the center, to the other side. Exhale at the side. Inhale, bringing across. Exhale, going around the side. Fantastic. Now if you drop your chin just one, yeah, perfect right there. Really good alignment, super. 2 more times. Don't let me interrupt your breathing pattern, so whatever way you're breathing, continue, but it is inhale across, exhale out to the side, inhale to bring across, exhale as you get to the side. One final time of head turns, mobilizing the cervical spine, your neck, facing forward. Shoulders, shoulder rolls. We've done it once or twice in aligning, but we'll do more repetitions here. Inhale, move the shoulders forward. Exhale, back and down. Inhale, forward and up. Exhale, back and down. Continue. Two more times to complete. Mobilizing that shoulder girdle. Activating traps and rhomboids. Opening up the pectorals one more time. Let this time be your final shoulder roll. Then finish with your shoulders back and down. Moving into the middle of the back, your thoracic spine. With cactus arms, elbows in line with your shoulders. cactus arms. I will demonstrate one repetition first. Inhale through your nose, and when you exhale, turning from your chest and shoulders. Don't have to go too far round. Inhale to bring across. Exhale, back to the side, keeping your arms back. Hips do not move with you, they remain forward. So everybody take an inhalation through the nose. Exhale and turn out to the side. Don't worry about going too far to start. Inhale to bring it across. Exhale, going out to the side. Fantastic. Mobilizing that thoracic spine, which is the middle section of your back. Excellent control. Fantastic. Yeah. Excellent hip control. Only the chest, shoulders and arms doing the movement. 2 full repetitions to complete, 2 to go. When you've done those 2, finish up, just facing forward, so I know when you're done. Excellent, finish there, thank you. Return your arms down by your sides, moving into your lower back. Inhale through your nose. Exhale, sliding one hand down your right leg. Inhale to bring yourself up and over. Exhale to slide down. Inhale, up and over. Exhale to come down. Don't worry about going too deep. Be aware of your back and what you're feeling. Moving with coordination and concentration. Mobilizing our lumbar spine, which is our lower section of the back. Feeling the lower back, the QL muscle on the back, your obliques. Stretching. One more side bend to complete. After that final side bend, standing normal. Pelvic tilt, I'm happy because we've done a few repetitions in our alignment, but for our hips and for our knees, we will do a quarter squat. Hips, feet, hips width apart. I'll perform one demonstration first. Inhale through the nose, allow your knees to bend, sitting back just a quarter of the way down. I fire my hands forward for balance. Exhale to raise. Inhale to lower, just a quarter of the way down. Exhale to raise. If you all join me on your next one, so think about sitting back, keep the chest tall, knees moving slightly forward, just a quarter of the way down, not too deep. Exhale to come up. Inhale to go down. Engage your core and pelvic floor as well. Yeah, not too deep. Just a mobilization for the hips and knees. Core is engaged, pelvic floor is engaged with that third point. Excellent balance. Everybody's technique is looking really well. If you'd like to add just 1 inch of depth, you're very welcome to. Yeah, I'm happy with everybody's form. If the 1 inch does not sit, do not worry either. Excellent. One final repetition to mobilize the hips and knees. Standing tall. Mobilising the ankles and the feet, we will perform a calf raise. So engage your core, engage your pelvic floor. Inhale, don't have to go too high to start, just going up on the toes slightly. Exhale to lower. Inhale to raise. Exhale to lower. If anybody's ankles, yeah, all normal, a couple of clicks around the ankles to start. That's why we mobilise in the first place, getting synovial fluid, getting blood flow around the muscles, ligaments, tendons. Excellent, yeah. Personal preference, definitely. Everybody's balance looks really well there. Stick to a comfortable height that you can control. Using precision. Two repetitions to go, making sure the feet and ankles are well warmed up. Final time. And rest. Really looking at a focus on balance next. So our bodies are aligned. I will demonstrate first. Inhale through your nose. And as you exhale, float your left foot forward and lightly touch the floor. Inhale through your nose. Exhale as you move out to the side. Inhale through your nose, exhale to come back to the start. So any movement is exhaling. At your points, you can inhale and take that oxygen into the body. Your core and pelvic floor are engaged. Complete balance focus off this section. Everybody's balance is looking really well. Because your balance is looking well, I'm going to encourage you just to add 2 inches of height. 2 inches of height, and if you can, keep it off the floor. Do, if not, regress back to your first version. Using our concentration. Yeah, perfect. So you've got your 2 options there, your progression to stand in the air, or your regression, touch the floor each time. One more time on this side. Once you've done that final time, feet stop and hip width apart. I will demonstrate once on the second side. Inhale through the nose, exhale to move, starting with touching the floor, exhale to move, inhale to point, 3-point touch to begin with. Second side, legs can differ in balance for sure. You might find here you feel more balance, you might find here less balance. This is what we'll identify in today's class. Core is engaged, your pelvic floor is engaged for spine bracing. You have a progression of keeping your foot 2 inches into the air. I am happy with everybody's balance there. If you would like to attempt that, if it feels too unsteady, please revert to your first version. Fantastic. Excellent control and precision. 2 more complete times to go. that single leg balance for the body. Once you've done your 2 times, return to our stance. I will demonstrate a brilliant flow for getting down to the floor. So we are going to do a lunge. 1 foot is going forward. Engage your core and pelvic floor. Inhale through the nose, and as you exhale, we will lunge, lowering 1 knee to the floor. Inhale and exhale to change to a kneeling position. And then once we're in that position, we'll move on. I'll show you the next stage. So we'll all face the same direction. Yeah, just for if I'm called out, sure. So we'll go facing to our right hand side. Most of us are probably right-handed. Doesn't matter if you prefer your left side, go for your left side. I'm right-handed, so I'm going to go with my right foot. If you prefer with your left foot, that's fine also. Engage your core and pelvic floor. Inhale before you move, and on your exhale, lunging and lowering 1 knee to the floor. Inhale, exhale to lower the second knee to a kneeling position. First main phase exercise is going to be an all fours position. So 2 knees are underneath the hips, hands are underneath the shoulders. If you follow my lead, so hands underneath the shoulders, head in neutral, chin tucked slightly so it's in line, parallel with your legs. Eye gaze looking down in between your hands. Neutral spine, neutral pelvis position. Our knees are below our hips and our toes are pointed, dorsiflexed. Fantastic. Good. Just come around, checking positions. Mark, if you bring up your spine just slightly into, perfect, into neutral, Jackie. If you do the same fitting, perfect. Really good. Now, if you do 1 inch as well, just bring your spine. Perfect. Go for there. Excellent, Nicola, if you bring your hands towards you just 1 inch. Perfect. Thank you. Very much. Excellent. So we're in our all fours position. First exercise is a glide and touching the floor Superman. So inhale through your nose. I will demonstrate one first. Exhale through your mouth and slide your right hand and left leg across the ground. Inhale to return to normal. Before you start, engage your core, engage your pelvic floor. Start with me on the next one. So inhale through your nose first, and when you exhale, hand and foot slide forward. Inhale, return them both back to normal. Perfect. Knees are hip width apart. Match up your timings with your breath then. So a normal breathing pattern is the timings of your repetitions. Spines stand excellently in neutral, no arching of the spine. Nicola, if you push your spine up just 1 inch, perfect, excellent, really good alignment. I'm very happy with everybody's pelvis stability. A progression, because I'm happy with everybody's positioning, We at the minute are gliding. If you would like to add 2 inches of height from the hands and the feet, you can. So exact same breathing style. This time, inhale when you exhale. If you want to add 2 inches of height, being very aware that our spine stays in neutral and our back does not arch. Excellent. Perfect, just those 2 inches. 2 inches is all we require. Excellent. Push the spine just 1 more inch again, lower that. Yeah, perfect. Those small adjustments, keeping alignment. 1 more full repetition. And once you've done that full repetition, just coming back and stopping at your all fours position. Still in an all fours position, I will demonstrate once first. Just checking our realignment, so hands shoulder width apart, head is in neutral, chin is tucked, spine and pelvis in neutral, knees hip width apart, toes pointed, plantar flexed. We'll move in adding rotation into the spine, thread the needle. To do this, inhale through the nose, start with the right hand, inhale through the nose, and as you exhale, putting the right hand underneath and having a slight rotation of the body. Inhale to bring it through, following with your head. Exhale as you thread the needle, pushing through, making sure we start off by not going too far. Inhale and bringing it back and through. Engage your core, engage your pelvic floor, starting with your right hand. Begin with the and exhale to thread the needle through, making sure you're not going too far. Inhale to open the needle, exhale to thread, getting that thoracic middle of the back rotation. Yeah, excellent. I'm happy with everybody's distance. Do not go any further, stick to exactly what you have just done. Rotating. Using some of our obliques, mobilizing the thoracic spine. I'm very happy with everybody's stability and alignment. So on your next repetition, do 1 more thread needle, and on your opening, add and extend your arms slightly, not too far, but just slightly more rotation and extended arm. Yeah, amazing everybody, really good alignment. Thread the needle on your exhale, inhale, bringing it out and opening. 2 repetitions, fantastic. Cervical spine, neck, head, and upper back movement. 1, yeah, perfect. Finish on that side. Moving in to the second side. I'm happy with alignment. Yep, if you're confident. Inhale through the nose. When you exhale, thread the needle. Not too far to start. Inhale as you bring the needle up and elbow out. Very important with everyday life to get that rotation off the back. scapular movers as well. In the thread, we're getting some pectoral movement going through anterior deltoid. On bringing the needle out, we are getting some trapezius, rhomboid, external rotator cuffs. Everybody's stability is perfect, so I would invite you to progress to that straight arm, slight more rotation. Two full repetitions to go. The core is engaged, the pelvic floor is engaged this entire time, as I said at the start. Final time into the all fours position. Changing starting position into a prone. Prone is lying flat on our bellies. So lowering the body down under control, I would put the hands slightly forward into a press up position. Inhale through the nose and exhale as you lower the body down onto the floor. For my prone position, I'm going to go for a W arm setup. So elbows up in line with our shoulders, create that W letter. Forehead on the floor, or we can to align our cervical spine. Forehead on a plank. Nicola, the Pilates block here. See how that feels in comparison. Yeah, perfect, Jackie. Mark, how does the neck feel? You can I'll apply this Pilates block, Jackie, as well for yourself, just to see cervical alignment. As well with Mark, see how that feels for the forehead. Yeah, thank you. Yeah, perfect. So that keeps the head in slight more alignment. Eye gaze is straight down, looking at the floor. Chin is tucked just as everybody is, parallel with the body. Spine is in neutral. Shoulders, move the shoulders down the back to engage slightly. Move the shoulders sort of towards your hips, slightly to engage. Spine and pelvis in neutral. Legs are slightly abducted. What abducted means is slightly wider. So widen the legs. Fantastic, thank you. Toes are pointed as you are. Plantar flexed. Extension is the plan of action for this next exercise. Engage your core, engage your pelvic floor. Inhale through your nose, and when you exhale, keep your hands on the floor and raising your chest up off the floor while maintaining your head position. So make sure you're looking directly down at the floor. Make a start there. Don't worry about coming too high. Really only start with 2 inches, to be honest. Yeah, perfect. Now that's you there. Okay, just now bring your elbows down. 2 inches, perfect. Thank you. Excellent. Get your breathing. Keeping your elbows on the floor now as well. Just 2 inches of height. Tucking the chin. Making sure our chin stays parallel with the floor. Looking directly down. If you feel your eye gaze Let's begin to look slightly forward, adjust it, and look directly down. Excellent. I'm happy with everybody's control and position there. A progression on your next repetition is to bring the elbows and hands off the floor, still only raising 2 inches is my recommendation. Excellent. Head position. Yeah, really make sure you know that next one, Jack. Even tuck the head, chin even more. Yeah, perfect. Thank you. Same thing, Mark. Tuck the chin just slightly more. Good. Same thing. That. Yeah, perfect. Thank you. Excellent. Change of head position. Really making sure that chin stays tucked and aligned. Working those 2 pillars up the lumbar spine, your erector spinae, any of your back extensors, your neck extensors. 2 repetitions to complete. After you've done those 2 repetitions, relax. Moving into a side lying position. For side lying position, we will begin with everybody facing front of the studio, so facing me. You can, it's up to yourself, we'll go through 2 options for head support. You can do with the arm or with the block. I will face you, just see what I'm doing. But if you face me onto your right hand side. Alignment, arm above or slightly at an angle, head resting in your arm. I'm going to go with a lower leg bent position. Lower leg's bent, upper leg is straight. Shoulders, pelvis, and knee should all be in a straight line. So have a look down, reassess if you need to bring the knees back in line slightly. Shoulders are aligned above each other. Same with the knees. Head in neutral. Lower torso, raise an inch or 2 into the air. Activate the lower part of the torso, bringing our spine into neutral, our pelvis into neutral. As everybody's head comes up, we can try a straight arm forward in line with your chest and a block setup. If anybody would like, but if anybody, just say if anybody would like that block alternative. Let's see, yeah, that's fine there. Side lying leg lift. Engage your core, engage your pelvic floor. Inhale through the nose. As you exhale, raising your foot just 2 inches into the air. So our foot comes up in line with our hip. Inhale to lower. Lower, stop just before you touch the floor to add that extra bit of difficulty so our hip never gets too much of a rest. Muscles, that outside abductor muscle, the glute medius, is working to move the leg. I'm very, very happy with everybody's stability. To progress, straightening our lower leg, Lower leg is straight, upper leg directly on top. Inhale through the nose, exhale as you lift the foot. Just those 2 inches again for now. You will hopefully find balance slightly more working, just to progress the body. Want an answer? You can give me sort of a rough answer. How's that side of the hip feeling? A little bit or a lot of engagement? Yeah, through the side. We'll not do too many more. We've progressed, especially with balance, a lower leg position. One more repetition. Letting the leg rest. Strengthening our glute medius. Strengthens our hip stability, our knee stability. So important for the lower body. And yeah, everybody resting. Side lying, leg lift. Moving into a lying on our back supine position. So lying on our back, legs, start off with bent legs for now. So back of the head resting on the floor, chin lowered parallel with your legs, eye gaze straight up to the sky. Spread your shoulder blades on the floor. Neutral spine, neutral pelvis. Legs one at a time. Straighten one leg down, then straighten the other. We will start with our left leg. Engage your core, engage your pelvic floor. Inhale through your nose, and when you exhale, foot is coming up off the floor, knee coming up towards your hips in a bent leg position. This position is called tabletop. Tabletop, where our knee is above our hip. Yeah, so just keep that position there. Now, yeah, go for it. Yeah, just hold that tabletop starting position. So yeah, perfect. Jackie, just 1 inch. Perfect, thank you very much. Toe is slightly pointed and relaxed, plantar flexed. One leg circle, engage your core and your pelvic floor again. Inhale and start to move your knee across the inside line of your body. So I'll demonstrate once if you need to. So moving from the hip. Inhale and move your knee 1 inch across the midline. Exhale to complete the circle, 1 inch coming around the outside. Inhale across the midline of your body. Exhale, come up and round. Circle size, about the size of a tennis ball to start. Small circle. Mobilizing the hip, using the adductor on the inside portion, your abductors, hip flexors on the upper portion. Pelvis not rocking, staying as still as you can through the pelvis. Both sort of sit bones or bones in the back of your lower back remaining in contact with the floor the entire time. To progress, we're only going to add 1 inch sort of circle, okay? So add 1 inch diameter, circumference, one or the other. So add just 1 inch increased distance of circle. Change direction, breathe in on the outside to start this time. Inhale, exhale this time to finish your circle. Inhale to start, exhale to finish your circle. Good, keeping the pelvis as stable as you can. Don't want any sort of pelvic movement. Pure hip mobilization. I would slow it down now, even slightly. I know it's getting tough, but we only got maybe 2 more to go. Slow it down even more, just to prevent any pelvis movement. Okay. Jackie and Mark add a progression, just a 1 inch extra circle, just for 2 final repetitions. Nicola, add that progression. Let that next circle be your final time. And relax your foot back to the floor. Straighten your leg, 5 seconds rest, just to allow some recovery, especially in that thigh. Rectus femoris, hip flexor, up the middle of the thighs. Breaking it right back down to the start for the right leg. Tabletop. Inhale through the nose. Exhale, bring it up. Our core and pelvic floor is engaged. Knee is above the hip. Inhale to start the circle. Exhale to finish the circle. Inhale, bringing it across the midline of your body. Right hip mobilization. Brilliant for that ball and socket joint. Pelvis remaining stable. 0 pelvis rocking. Excellent. Adding that 1 inch as long as your pelvis remains stable. Excellent. Really try and 0. Now, Nicola, even if you just go back to your tennis ball just for the final 2, just so your pelvis isn't rocking at all and we've got pure stability in the lower back. Changing direction. Inhale to start the circle. Exhale to finish the circle. Inhale to start. Exhale to finish. Your core and pelvic floor are both engaged. Think about that built analogy and 10-story building analogy. Mark and Jackie add that 1 inch progression. Yeah, really good now, and Nicola. Pelvic stability. Good. Far less rocking of the pelvis on this second time round. 1 final repetition to complete. We went both directions, haven't we? Yep, on this second side. On your final time, letting your leg straighten and relax. Side lying leg raise. We face the door in the front first. Now we will face the opposite direction. So facing the back of the studio, our side lying setup, arm up, head in neutral, chin parallel with our foot. Lower part of the torso raised, engaged up off the mat slightly. That will bring our spine into that neutral position. Shoulder above shoulder, knees above each other. Yeah, that lower, now if you change your lower leg just into that bend position. Thank you very much, perfect. Yes, excellent alignment. Shoulders, pelvis, knees and foot are all in one straight line. Foot is dorsiflex, so pull your toe up towards your shin slightly, just so it's a straight line. Engage your core, engage your pelvic floor. Inhale through your nose. As you exhale, raising your foot 2 inches into the air, just so it comes up in line with your hip. Working that glute medius, those abduction muscles on the side of the hip. I am really happy with everybody's posture, alignment and stability. So I would invite everybody to progress and moving this lower leg into a straight position. One leg atop of the other. Inhale through your nose as you exhale, raising the foot. Just that, 2 inches, not too high, up in line with your hip. Match your repetitions with your breathing. I'll not interrupt your breathing flow. Ignore my teachings, whatever stage of your breath and repetition you're at. Yep, you are. Exhale on the way up, inhale on the way down. Your core and pelvic floor this entire time has remained engaged. We have progressed the balance aspect of this exercise with the lower leg going into a straightened position. One final repetition to complete. The side of the hip is definitely getting recruited, as you have been feeling, I'm sure. Finish your last repetition now, resting in that side lying position. Moving into a seated position. To do that, if you want to lie on your back first, you're very welcome to. Supine position. If you want to inhale through your nose, exhale, bring your feet into position, or one or the other. Using our hands, inhale through your nose, exhale, using a bit of momentum, come up to a seated position. Find those 2 bones within the pelvis, the sit bones. Lengthen up through the spine, lengthen up through the neck. Hands placed behind each thighs. Feet our hip width apart, knees and feet are in alignment. Now let's lengthen up 1 more inch, lengthen up the spine, fantastic, thank you. Mark, lengthen up through the spine, fantastic, excellent, thank you. We are going to perform a seated half rollback. Engage your core, engage your pelvic floor now. Inhale through your nose, and as you exhale, allowing yourself to come back, allowing your spine to flex into a C position. Inhale to use the abdominals to bring yourself back forward, and at the top of the rep, lengthen up through the spine again. So inhale through your nose, exhale as you come back, allowing your spine to flex. And this is one we actually encourage our spine to bend into that C shape is fine. Ignore my, go into your normal breathing patterns, because I'm going to be talking away here. Match it with your breathing. Yeah, so definitely working on flexion here, allow the spine to bend into that C shape. And this is one exercise where we are actually looking for your spine going from a neutral position into a crunched position to get that flexion. So flexion going back, flexion coming forward, and at the top of the repetition, good. Closing your knees slightly, Mark in together, thank you. Nicola, closing your feet just 1 inch hip width, thank you, perfect. I am very happy with everybody's control here. To progress on your next repetition, when you go to exhale lower, release the hands from the back of the knees. We're only going back a little bit, don't worry about going too far, but now we are performing the entire exercise without any hand assistance. Working those rectus abdominis muscles in the stomach, assisted by our hip flexors, muscles the front of the hips, strengthening these front stomach muscles to strengthen the core, which in turn will reduce our long-term back as well. 2 repetitions to go. Hopefully everybody is getting a bit of stomach engagement. This is our final main phase exercise. We have 1 main phase repetition to finish. Mark, if you narrow your knees just 1 inch, thank you, perfect. Very, very, very good. Thank you, everybody. Excellent. On your next repetition, hands back on your legs, give your abdominals a bit of support. To close the class, we want to lengthen some muscles, the hamstrings, for example. To do this, we will slowly let yourself come down. If you want to use your hands on the floor as well, to lower yourself into a supine position. Both legs are straight for the first one. Alignment, back of the head on the floor, chin parallel with our feet. Gaze is forward, spread your shoulder blades out and lower them slightly towards the floor. Spine is in neutral, pelvis in neutral. The tabletop position that we went and discussed for our one leg circle. Inhale through the nose, exhale to bring the left knee and foot up into a bent leg position. Hands placed behind our thigh. Inhale through the nose, and as you exhale, straightening the foot up to the sky with a relaxed foot position, so toe slightly pointed. We will use a Pilates block now for your head, for alignment. Reduce it slightly now, so we want a long knee, so we want that knee fully straight, even more as well. If you want to let it out, yeah, perfect. Have long knee position. Really good. Using a block for our head mark as well, just for our cervical alignment, Nicola. Reduce the stretch slightly, straighten the knee more, so let that knee come away from yourself. Add the block to your head. Long knee position, yep, very good, very good. This being a developmental stretch, 30 seconds is the plan. Yeah, perfect now. Even let it release the grip slightly. Release the grip slightly, straighten the leg from there. Let your leg go a little bit further away from yourself if you want. Do you mind if I adjust hands on correction? Okay, thank you. So if you go straight leg again. Yeah, right there. Perfect. Inhale through the nose. Exhale through the mouth. Good. Yeah, just keeping that position there if you can. Nearly done. Thank you. Now that is super. Does that feel okay on the muscle? If you need to release the grip slightly again, please do. Not a problem. One more deep inhale. Now, if you even rest that foot on the floor, that's perfect for now. Take a good rest for the hamstring. Thank you. Inhale through the nose, exhale, and if your leg is freer and comes an inch closer, do. But if it does not, yeah, like some more, I would now just keep it at the first version. 3, 2, 1. Return your foot to tabletop, bent knee position. Lower that leg to the ground. Inhale through the nose, activate the core and pelvic floor. Bring your opposite, your second leg up to tabletop, bent knee position. Hands behind the thigh. Inhale through your nose, exhale, straighten your leg. We're looking for that long knee position. So if you need to lower your leg away from yourself, please do. So that, flex the nail, even lower it another inch, and then straighten your leg slightly. Good, relaxed foot, toe pointed. Actually, now we'll just go for a stretch. Now if you just hold down, don't worry about movement on this one, perfect, just hold that there. Nicola, lower 1 inch away from yourself. Think of that long knee, so straight knee. Using your breathing throughout developmental stretch. Fantastic, everybody. Even 1 more centimetre or 2, Nicola, thank you. That's amazing there, good. Excellent, just to get that alignment of the knee, even 1 centimetre lower, Mark, if you want to as well. That's perfect there, yeah, perfect. Good. Deep breaths. Deep inhale, deep exhale, lengthening the hamstring. 1 large inhalation, and when you exhale, if your hamstring is freer and becomes a centimetre closer, do. If it does not, please do not force it. We're doing this under control. 5, 4, 3, 2, and 1. Inhale, exhale, returning your leg down to the floor. Gluteal stretch. We will do a first phase version and a second phase version. Starting off, inhale through the nose, exhale, and bring your foot closer to you. So a bent knee position, your foot closer to you. Your other leg is going to come up into the air. Inhale, exhale, and bring your shin across to your knee. With your right hand, you're going to add just 1 centimeter of pressure on the inside of your knee for the first 5 seconds here. Just, yeah, perfect, Mark. You know where we're going with this. Excellent. Second phase, now, because of the angle, you stick at first phase, you regress and stay down. Perfect, Mark, second phase. Jackie, go for it. Yes, I'm happy with that angle there to add a little bit more gluteal. Excellent, Nicola, fantastic. Maintenance stretch. Shorter in time, just 5 seconds to go. 4, 3, 2, 1, and relax. Swapping the legs over, return your first foot. Start in position. Yep, Niall. Yeah, just stay in first phase, Niall. That's perfect there. 4, abduction. 5, yep, perfect, everybody. Fantastic. You know your own body. Good. Going into that gluteal full stretch for 10 seconds. Using your breathing, lengthening the back of the hip. 3, 2, and 1. Relaxing the legs back onto the floor. We are going into a kneeling hip flexor position. To do this, roll onto your left side, turning around, facing down. We're going to start with our right knee on the floor. Come to a kneeling setup. Straight line, head, shoulders, knees, toes behind us. We're going to start with our left foot coming forward, going into a hip flexor stretch. Inhale through the nose and exhale as you forward lunge, opening up the hip flexor and psoas muscle. We're going to go into that maintenance stretch. Yep, go into the stretch and just hold it at that lengthened position. 8 seconds on the clock. Front off the right hip. 5, 4, 3, 2, 1. Slowly coming back to neutral. Swapping the legs around, kneeling position. Swap the foot through. Inhale through the nose, exhale as you forward lunge. Feeling that stretch front off the left hip. 8 seconds on the clock. Normal breathing pattern, inhale and exhale. 3, 2, 1. Coming back off the stretch, 2 knees, kneeling position. Moving into the child's pose. Hands onto your mat. Walk your hands forward and sitting back. Inhale through your nose, exhale and sit back into a child's pose position. 10 seconds on the clock. Engage your core and pelvic floor. Lengthening the shoulders there. Great for your latissimus dorsi muscles up the side of your back. Lengthening your lumbar, thoracic spine. Lengthening your gluteals. 3, 2, 1 more deep breath. In and out. Similar position. Our forearms are still on the floor. Coming back slightly. A little bit of a gap between our hips and our feet. And we're going to move into wrist rolls. So just in this nearly all fours position. Wrist rolls moving around in one direction. Mobilizing the wrist, change direction. Second. and relax. Using our hands to come back up to a kneeling position. Moving our right foot forward. Inhale through the nose. Exhale to lunge to standing. Turn facing me, you're nearly there. Going well. Moving in to the shoulders, arm circles, just 6 repetitions. Inhale, move the arms forward. Exhale, complete the circle. Don't worry about going too far back. I find that's where any sort of clicking and grinding can occur. Inhale forward. Exhale to finish. Mobilize the shoulder one more time, then change direction. 1. Inhale to start your circle, exhale to finish. One more full circle. Final mobilization for the feet and ankles. Hip width for the feet. 1 foot up in the air. We'll go for our left foot. Wrist, ankle circles, sorry. Now, if it's feeling a little bit bad, if you want to put 1 toe on the floor, regress. Go 1 toe. Yeah, go for the toe, definitely. Not a problem. If you want to progress, ladies, fantastic. I'm very happy with your balance. 1 direction, then into your 2nd direction. Inhale to start, exhale to finish. 3, 2, 1. Placing the foot back. First version, on the floor. Doing a circle. Change direction. And then I am happy, ladies, yep, just as you demonstrated in the first version, up in the air. Inhale to start, exhale to finish. 3, 2, we've changed directions, haven't we? One way then the other. Final alignment to finish. Feet, hips width apart. Knees, slightly soft, not locked. Pelvis, bucket. Engage your core and pelvic floor. Inhale through the nose, exhale out the back once. Inhale, exhale through the middle forward. Inhale, exhale back to your middle. Pelvis alignment. That will align our lower backs. 1 shoulder roll, inhale forward, up. Exhale back and down. Once they're back and down, stay there. Lengthen up through your neck. Chin lowered slightly parallel with the floor. Eye gaze forward. Bodies are aligned. Home care advice, that is our class done. That's everything through. Some home care advice. Hydration, so we've worked there, so fluids, water, any sort of fluids for hydration. Homework is going to be your core engagement practice. It's going to be your pelvic floor activation and postural awareness. So we're all aligned in a perfect posture. This is what, in the queue, at the shops, on the sofa, watching TV. This is the posture we are all aiming for and will improve our class. Thank you, everybody. Excellent. Thank you very much.
Good.